Hi, everyone, and thank you for being here, and welcome to the occupationaltherapy.com podcast. I'm really happy to be joined today by Arlene, who is a faculty member at Colorado State University. Arlene, could you just introduce yourself and tell us a little bit about what brought you here today?
Sure. Hi, everyone. I'm Arlene Schmid. I am on my 10th year as a professor here at Colorado State University and in the Department of Occupational Therapy. And before this, I was at Indiana University in the VA as faculty and as a research scientist. So I've kind of been doing research for about almost 20 years, and most of that research is about yoga and the benefits of yoga for people with disabilities, as well as integrating yoga into occupational therapy.
Wonderful. So, could you just tell us a little bit about how you got interested in yoga and sort of introducing that into your practice?
Yeah, it's a great question. And I think it's kind of what's happening now in the yoga world when we think about yoga and therapy. But I am from Buffalo, New York originally, and there was not really any yoga that was hanging out. Yoga's 5,000 years old, but it's kind of this new hot topic right now. So I quickly moved from Buffalo to Hawaii right after I graduated from occupational therapy school. Yep. I made a beeline
Where did
to
you
a
work in
different life.
Hawaii? That's
Um,
fascinating.
it was great. Yeah, I was on the island of Oahu, so Honolulu the whole time. But what happened is I started doing yoga and I started loving yoga and it felt great in my own body. And then I had about 5 jobs in 5 years, as many new grads do as they're moving around, and started to really see benefits of yoga kind of regardless of who I was working with. So I was in skilled nursing facilities, I was in inpatient adolescent psychiatry, I was in schools a little tiny bit, and I then ended up in a outpatient hand clinic. And so really using yoga with all those different folks, I just kept seeing this trend of I can really see nice results with people. They're wanting to integrate yoga into their daily life. And so kind of started to try, as any good OT, to look at the evidence and quickly found there was none. At the time, there was only one study that I could find on yoga for carpal tunnel syndrome. When you think of kind of rehabilitation and yoga. So I made the very hard life choice to leave Hawaii and go do a PhD. So that's a really hard choice, right? Like this lovely lifestyle or, PhD lifestyle. And I went to the University of Florida and did my PhD and was able to kind of focus my studies there. I knew I wanted to work with older adults. And so I did a lot of education in older adult education or older adult exercise physiology, because of course there was no one talking about yoga at that time. And in fact, I was kind of told, don't talk about yoga. This is going to go nowhere. And then, yeah, so I kind of felt like I learned the skills I needed to be able to do research on yoga, and then went to Indiana and the VA, and the VA, as you can imagine, right? This was about
They embraced it
2005.
quickly, I'm sure.
They did not embrace it quickly, but some of the clients really embraced it quickly because there was this sense of I'm sick of being on medications or I'm sick of everyone just throwing medications at me. And so there was this kind of internal patient level movement that was happening. People coming back from Afghanistan and Iraq were kind of like, I don't want any more pills. I want to try yoga. And they had been, there was this movement of it kind of starting to happen. And so the first, like I would call bigger grant that I got was for yoga and stroke. And so that population is a little tougher, right? Because they're older. They were World War II veterans and Vietnam veterans and things.
Also known for their interest in yoga.
Yeah, yeah. So it was quite a challenge, as you can imagine. But at the end of the day, our benefits keep showing up, and we keep seeing really nice changes in multiple populations and in different outcomes. So physical outcomes as well as emotional and cognitive changes, which is really exciting when you think about what we do in rehabilitation and the outcomes we're looking at. And in OT, we're always talking about being holistic and treating the whole person. And I think yoga is a way to do that versus it's not just physical exercise, it's truly connecting the mind and the body.
Wonderful. So can you talk specifically, so there's lots of different types of yoga and, obviously a lot of pediatric OTs are using yoga with the students and the clients that they're seeing. But can you talk specifically about maybe some neurological conditions that you found? You mentioned stroke, but other things maybe that yoga might be useful for other populations.
Sure, and I will say the one population I really have not worked in is kids, is pediatrics. But you are right that it's really taking off, and I think people feel calmer, and so we that's why there's a big push using it with kids. But in our work, so we really did that stroke study, and then we also did a brain injury study while I was still at the VA. They're veterans, they had brain injury, and they had kind of heard about it and actually came to us and said, we want this now. And then from both of those studies, we always do qualitative research, right? We always ask, like, what could we change? What could be better? And something we kept hearing was, I wish I had this before. I wish I had this earlier in my disease or disability, because we were really working with folks with chronic stroke, chronic brain injury, 20, 25 years after their injury, right? Or their stroke onset. And so from there, we went into inpatient rehab at the VA and at a local rehab hospital. And so that was really cool. Like as a scientist, I didn't do it right because I was like, yoga for everybody. And
Where's your
that's not
control
really,
group? That's right.
yeah, that's not
Who are
really
we going
what
to
you should
withhold it
do,
from?
right?
Yeah,
I know.
yeah, it gets
Right,
interesting ethically.
exactly.
Yeah, yeah.
Yeah, but as the OT and as the yoga lover, yoga for everyone was turned out to be great. And so we had folks with spinal cord injury, brand new spinal cord injury, locked in syndrome, very acute stroke, very acute brain injury. And we are able to see that adding yoga or integrating yoga into rehab for all those different populations really help calm people, calm their nervous system, help them be more able to sustain life in rehab, right? Like if you think of all the tests and the MRIs and always waiting for other news or always waiting for therapy, it really gave people a tool to calm themselves down, be more okay in the MRI machine, be less worried about the next thing and kind of be more in the moment. And so of course we've not done a randomized controlled trial of this, right? Because it'd be really challenging to do. But it kind of leaves us with a lot of questions. But to finish your question as other populations, I mean, we have really also done diabetic neuropathy and other neuropathies as well, and then chronic pain, which is not necessarily neuro, but a lot of neuro is involved with chronic pain population. And also Parkinson's disease as well.
So lots of different types of uses. So we know each other decently, I would say, and so you've seen maybe my lack of flexibility when we're in person, and this has been chronic. So back when I was in occupational therapy school, many years ago, people would try not to be my lab partner for when they had the little pick the range of motion test question out of the paper bag to see if you were able to assess your partner, because I am lacking range in a lot of different places. So I'm pretty novice to the idea of yoga. And so there's a lot of different types of yoga that's out there. Could you just talk a little bit about maybe the types of yoga that is out there and what you might really think would resonate specifically with occupational therapy personnel that might be listening?
So there are many types, as you just said. Mostly what is here in the West is derived from Hatha yoga. But they can look really different. And so people can kind of hear about things, or if you just Google yoga, we can get into trouble, right? Because you might get pictures of people standing on their heads or something. So as you can imagine, we stay far away from standing on their heads. And I would say so while there's different styles, there's just words that mean different flows or styles. We really kind of stick with Hatha yoga because all yoga should have breath to movement, but some yoga has breath to every breath equals a new movement, and we want to stay away from that. So while we move to breath, we also hold in a breath. So we might go into a posture and then have people really focus on their breath, but stay in that posture rather than moving in and out. And we have found that is what makes the most sense for our folks when you think of a chronic stroke population or someone else who has limited range of motion, limited mobility. They're also likely having some fear of falling. And so getting up is potentially fearful. And we do try to get folks to the floor. And so there's a whole lot of anxiety rolled into that, as you can imagine. But we really try and do a very slow style, a very safe style that includes probably less postures, but more time for people to process the movement and what we're asking them to do. And then we really want every person to feel successful when they leave. And so we provide a lot of hands-on assistance, but also a lot of modifications, which I think just leans into occupational therapy so well. Like we're just the experts at modifying things and meeting people where they are. And so yoga is just naturally so modifiable that it's a good fit for us. But I do always worry if people just Google yoga, they tend to get like the 20 something standing on our head. And so I'm trying to move us away from that and reminding us anyone can do yoga. It is thought that anyone who can control their own breath can do yoga. And there's actually some OTs who have even done yoga in the ICU with people who have been trached as they're starting to work on their own breath control because breath is yoga. And it doesn't have to be all those postures that we tend to think about. And so I think we're always thinking about safety for sure, and making sure, we're not setting someone up for a fall or something like that. And so we we are modifying quite a lot.
So could you just talk a little about some of those modifications potentially that you've used in your own practice?
So some big ones are first of all, everyone gets a yoga mat, right? And then yoga blocks, which are little rectangular kind of foamy blocks. And then we also buy things like blankets and bolsters and there are these big round bolsters that people can kind of, if you think of, a lot of times in yoga, we might do a forward fold, so folding at the hips, and we might do it while we're standing, but our folks might want to do it while they're sitting. And so if we use a bolster kind of at their belly, they're able to fold over that and get the benefit of the forward fold without having to stand. And the blocks, I mean, we just do so many things with them. Even sometimes just putting a block under someone's feet while they're sitting to make them feel more grounded, right? So if we have someone whose legs are swinging in space, just because they're shorter, just that block helps them feel more grounded. And a lot of times that's something people are doing in the schools. It's just like getting kids' feet on floors. It's not that hard, right? It's
Yoga
not
or not
even,
yoga? I think that's
right.
a
It's not
general
even,
rule of
right.
let's get every kid's feet on the
Yeah.
floor that's in a
Get
school.
their feet on the floor and ground them down, right? But it's the same for our older adults with neuro. Um, and so we also, like I said before, we like to get them into standing. So we tend to use a chair. So we start everything in chair yoga to kind of get a sense of where everybody is. And usually we stay in a chair for 1 or 2 sessions and kind of see, how do they do standing up? What are their abilities? What are their levels of fear? And then we start moving them to we stand up and we go behind the chair and we use the back of the chair for support. And then they can graduate to maybe using a wall. And then some of them truly graduate to being able to just do a posture, which is exciting for them and us to see. But again, normal everyday yoga uses blocks and belts and bolsters. And so I think it's nice because they just feel like, oh, I'm using a yoga block or a yoga belt. And so it doesn't feel like they're doing something because of their disability. It just feels like they're doing yoga. So that's kind of nice. If I go to a yoga class, I'm always using blocks and belts to be able to get myself into the posture. And then the getting to the floor is really important if we can do it. We should know things like we don't really get people with a big round belly laying on their belly, right? And those round bellies are kind of common after stroke. It just kind of comes with the territory. And so we really only do things in supine, but it can be really powerful for people to feel more comfortable on the floor, to practice getting up and down from the floor. And then what people love in yoga is called shavasana or corpse pose, where we just lay there and we say the it's the time for the practice to integrate into our body, and so it's kind of the best time, right? We're just laying there breathing, and lots of times people fall asleep, and so they're very comfortable, and that's people really look forward to that part. So we do try to get it to the floor because it's so much better in the floor than on a chair.
Gotcha. And I guess that's where our grading abilities come into play as our training as occupational therapy practitioners. So in
Yeah, I
a
think we're so
uh,
good at it.
yeah, absolutely. I knew an OT once who she was actually a certified hand therapist. So it was interesting to hear the carpal tunnel, that early study on carpal tunnel. Maybe that's why she got into yoga. But she was really I would say opposed to sort of, and for us it was a lot of, when I was teaching in a university, a lot of students would go to a yoga class and then want to kind of integrate it, with patients. And she was really opposed to that and really just thought that yoga had to be taken seriously and that you needed really proper training to be able to start integrating yoga into your practice. So you've talked a little bit about that, but generally, what are your thoughts about that? And if someone is interested, how would someone go in and get training in yoga to start integrating it into your practice?
Great question and very timely question. So if you happen to be an OT student at Colorado State, you get a whole lot of it from me, right? I integrate it into my coursework. We talk a lot about breath work. So I feel really comfortable telling an OT it's okay to work on breath with kind of anyone, but you need to know, like, why are you doing that? Just like anything, why are you doing it, right? And because we can make people more awake or more sleepy or stand up straighter or all of these things through breath. I think we all have the ability to say, I need you to take a deep breath, slow down, and calm down your nervous system. And we know that happens because the vagus nerve runs right through the diaphragm. So when we take a deep breath, we get parasympathetic nervous system and we calm ourselves down. And so I think any of us can remember that and take a moment with our client or ourselves and do that. I think when we start getting into more specific postures or breath work, we do need a little more training, but it's like anything in OT, right? And so I think it's fine if someone, for a good reason says, oh, well, let's do this pose, like warrior one or a lunge or something, right? Because it opens up their hip flexors. Is it really yoga or is it really a lunge, right? There we're trying to open up their hip flexors. So I think there's this fine line. I think if we're using it for someone who enjoys yoga and it's their occupation, full on, right? And then there's this other area that we're probably taking bits and pieces of yoga and integrating it into our practice for best results. And then there's this whole other group that only use yoga in their clinical practice, OTs, PTs, and those folks are more likely to be like a yoga therapist and an OT, and they're only using yogic practices. And so that's a really different person who needs a lot more training. So I think it really depends on kind of what you want to do. And if you find yourself really integrating yoga, then get more education about it, right? Understand the philosophical underpinnings of yoga through a yoga teacher training, right? And that'll just help the therapist be a better therapist. But I think we can do a lot by telling people that they need to just, even before you walk into a patient's room, take a breath and be in the moment, right? We know breath really helps people be aware and be in this current moment. And so I think our therapists are better if they are not fretting about other things, but I think our clients are better if they're not fretting about other things. So yeah, I think there's this, I'm not opposed to people doing yoga if they're not a fully trained yoga teacher. I think it's like anything as OTs, right? Is it a modality? Is it the occupation? It's somewhere in the middle for folks.
Right. Yeah, we actually hired an occupational therapy student who did some work with my mother, who passed away a few years ago. And so she would go and just kind of hang out with her. But one of the things she started to do was some breathing technique that was just beautiful to help my mom with her anxiety. And actually, it was really powerful at a prayer service after she died that the student kind of led everyone that was there through the busy bee breathing and just kind of and showed us what she did with our mom. And it kind of it was just amazing to see the difference in the room after she did that with everyone, and was just a really just a kind of a sacred moment that our family still talks about. So
Oh, I really love that. And the energy that comes from a group is truly different. Even that one-on-one yoga versus the group, it is so powerful. And we don't know what that means. There's no way to research that, but we feel it for sure. And our participants talk about that, with different words, right? But it's like this way to connect with people that's different than just showing up to a support group or something like that. Yeah, it's really powerful.
yeah, just a great moment.
Oh, I love that story.
Yeah.
Yeah.
So an OT is starting to get some training in yoga and is starting to feel comfortable, starting to integrate it into your practice. So you talked about some of those conditions that you felt like yoga was appropriate with, and really in some ways, maybe the vast majority of the clients, the patients that we're working with, probably could benefit certainly from the breathing and the relaxation aspect of it. Could you talk about how you're relating yoga to occupational performance, and kind of how you're starting to see some improvement in occupational performance?
Yeah, I get super excited about this. So a couple things. One, I think yoga is great and yoga's not enough. Like I think it's best when it's merged with occupational therapy, and we can talk about that, but that's when I think it is the most powerful. Um, but I will say most of our studies have been yoga only, right? We're now shifting to merging yoga and OT. But what we have found over and over is this really dramatic change in quality of life. And then we've started doing the COPM, right? The Canadian Occupational Performance Measure, and see really over and over again significant changes in performance and satisfaction with performance. And that is like chronic pain, brain injury, Parkinson's. And that's really cool because we are not talking about those things, right? We are not talking about those five things that they found important but challenging. We are really truly doing yoga. But in yogic philosophy, we think that the physical body changes first with yoga, and then it kind of moves forward. And I think when people feel better in their own body, right, and they have more range of motion and more balance, it allows them to do more things that they want to do. We also tend to see this very, I can't explain it, but a change in confidence, and it's confidence in general. We started just thinking it was balance confidence, and it turns out it's really confidence. Like they feel like a different person and they can do more things. And so that really spirals pretty quickly. Most of our studies are only 8 weeks. Pretty quickly, we see these changes in occupational performance and satisfaction. And then the other interesting thing is while we tend to see the change in performance, the change in satisfaction is what's really big. And so it's more like, okay, I've changed, I can do this better, but it also seems like they care, or like they've shifted in how much they're worried about things, and so their satisfaction with how they do things is just better because maybe they are less caught up on something, or they're less like worried or anxious about this thing that they couldn't do before, and now they're kind of like, yeah, I guess I'm doing it okay, and okay is enough. This is the part of the trouble with yoga research, right, is that people tell us so many things that change, and some of those things we don't have an outcome to go with it, right? Yeah. I've had people just say like, you've changed my life, you've rocked my world, right? And I love those quotes, but I can't measure it, right? um, oh, they're really the best. They're really the best. Yeah. Yeah. So it's really exciting to see those changes in occupation. I mean, as an OT, right? That's where I'm trying to get at. And if we can do something, we do twice a week for 8 weeks, and somewhere in there that much change happens. That's really exciting for me.
So when you were thinking specifically about neurological injury, what are the types of or what's the evidence that shows that yoga has been beneficial for? in terms of making those changes? I know we talked about some qualitative changes, certainly in terms of quality of life, but any physiological changes or things that you can measure?
Definitely. There are definitely things that we can measure and that we do measure. Like I said, in yogic philosophy, but I would say I see it. What they think, yogis think, is that first, if we're not living in health, like a healthy lifestyle, we first have some cognitive impairment. So that idea of like, where did I put my keys? Or where, we all do this, right? But it's that cognitive, like, oh, I was doing something but forgot. And then emotional impairment. So that idea of like, oh, I might be crying and just losing it for no really great reason, but is happening. And then the physical changes. And then when you add yoga, we see physical improvement first, then emotional, then cognitive. And I would say that that's what is happening with our folks. So again, folks with a stroke 20 years ago or something, but we first really see those physical changes and very measurable changes in balance, balance, strength, range of motion. We have done studies with the Neurocom, so a very computerized measure of balance, and you can just see the structurally they're putting both feet down more equally and things like that. And so we're really able to see those physical changes. I can physically see a change in posture at about week 2 or 3, that they're just sitting up straighter, right? And if we sit up straighter, we're breathing better, and all of those things kind of fall into each other. And then we start hearing about those other changes. So we measure things like emotional regulation, and they tend to improve. But the other things we hear are, I don't cry at every Hallmark commercial anymore. Or
What if we want
I
to
don't
cry at the
have,
Hallmark
I
commercials?
know, they're
That's
the
right. They
best,
are.
right?
Absolutely.
Or they'll say like, my wife just told me she feels like she got her husband back, right? Like, so that is not something I can measure, but I hear time and again. We hear really great stories like, I can walk up the stairs for the first time since my stroke, which is great. But the point is, I can sleep in bed with my wife for the first time since my stroke, right? So there's that shift in emotion and emotional attachment that came because of those physical changes. And, physical is way easier to measure, right? And it just tends to happen faster. I would say, one thing we don't know is, so we picked 8 weeks because most exercise science kind of things are about 6 weeks. And so we wanted to kind of line up with exercise because we didn't know where to start otherwise. What people are now kind of trying to figure out is the dose of yoga. And, we don't know the dose of OT, right? Like, what's the best dose? We have no idea. And so it's kind of
20
the
minutes a
same
week for life. I'm just
forever.
kidding.
We all need
Yes,
it. We all need
that's
it.
right.
And so we are trying to figure out, like, we kind of think more is better, but does it need to be twice a week forever? Probably not. But we don't know. And so there's some work happening to try and figure out when people start to see the change or feel the change, because maybe it's at 4 weeks, right? Or whatever it is. And so there are folks who are trying to figure out the dose. And there's actually some research, particularly in brain injury, that one dose of yoga helped people feel way better, which is kind of exciting, right? And so there's a ton of questions to still be answered, but I get really excited. I mean, I certainly am excited about physical improvements, but I get really excited when people are like, I feel like myself for the first time, or I'm getting back to the thing. I mean, they don't say occupations, of course, right? But I can play the piano again, right, for the first time since my brain injury, or whatever the things are. And so that's where I get really excited for people when they feel like they're living their lives again.
Right. And it's kind of like that snowball rolling and getting bigger and bigger. Once physically they're starting to improve and then emotionally they're feeling better, then they're able to do more occupations, even though they don't say that. And then everything kind of snowballs and gets better and
Yeah,
makes it
and then
challenging
even
as a
things like
researcher to try to figure out what is what.
it does, but it's exciting. And what is for me exciting is I left the clinic and I loved being in the clinic. I love being an OT, so it's hard to leave. But I left to do this, and 20 years later, it's what I'm doing, right? So that's really exciting for me and makes me feel like, okay, I made a good choice and I'm doing this and I'm adding to the literature.
And you're not in
Um,
Hawaii, but Colorado's still pretty cool. I mean,
yeah,
it's still in like a
Colorado's pretty
top,
awesome.
you know. I mean, you're not in name whatever state you would like to name, but I will
No,
not
it's
because there's probably a
quite
listener from that state
lovely.
right now.
There is
So,
probably a
absolutely.
listener. Yeah, so Colorado's lovely, and we get to go back to Hawaii pretty often, which is nice as well.
That's really nice. So I think the other thing you've you've sort of mentioned pain as well, and I would think especially with your early work in the VA, and it's such an issue for a lot of our veterans that are served by the VA that have had chronic pain and have become dependent on medications. Can you talk a little bit about pain specifically and how you can? I don't know. Does it help build their confidence in terms of trying to get away from medication?
Yeah, I would say we've seen really nice results in SAME. We've seen really big changes in COPM. And then we've had this kind of interesting mix of people who want to keep progressing and do somewhat come off their meds. We ran a yoga pain study in a local pain clinic, and they were so happy with the results. They actually hired our yoga teacher, who was an OT, to continue. And then I had a student go back, so they got yoga for like 2.5 years or something, and interviewed 10 of the people and did COPM. And I mean, those changes were outstanding. And like one woman just said, "Oh, before I was only existing, and now I'm living." Right? Like, oh, it's so good. And she also said, "I stopped kicking my grandbabies." So I don't know what was happening with
Yeah.
that. But she was really happy that she stopped kicking her grandbabies, right? But then there's this other group who is, I don't know what I don't know what it is, but they really identify with their pain, right? Like they're the people you meet that you say, "Hi, how are you?" And they're like, "I have had pain for 20 years," and it's their identity. And they struggled. They actually tended to be the folks who dropped out um, because I think so much of their identity was wrapped up with their chronic pain. And we weren't offering like, well, how do you manage this shift in who you are and coming back to occupations after maybe 10 or 20 years? And we even had a couple people, interestingly, who they needed less drugs, less opioids, right? Specifically, and they were really afraid that their doctor would take their opioids away because they felt so much better. They actually dropped out because their pain was so much better, but they had an addiction, right? And so those were interesting issues that we didn't expect to see. And so most of the folks kind of, their pain didn't go completely away. In fact, we use something called the brief pain inventory, and some of the items, there's a total score for pain severity and then a pain interference of pain on everyday life. So very OT. And really, our pain severity didn't change, but the interference of pain on everyday life changed. So, significantly improved. And so, what people kind of qualitatively said is this idea of, well, the pain didn't go away, but I could put it somewhere else. Or I could think about other things and engage again, not kick my grandbabies um, out of anger or whatever that was. Um, and so pain has probably, of all the studies I've done, is probably the most challenging population. And I think it's because pain is so diverse, right? It's another idea of me being not a good researcher was again yoga for everybody. And if people had migraines, they could be in the study just the same as I had folks with low back pain. But then I had people with radiation burns internal from radiation after cancer, right? And so those types of pain are so different. And so at the end of the day, they're all pain, but the pathways are really different. And the pain 101 that we'd want them to understand is probably different. And so if you only did a low back pain study, it might look a little different. But when you just took pain in general, again, like yoga for everybody.
We needed to train you as a researcher before as an OT.
I know. It's really hard. It's really hard to have only the researcher hat on, right? And so sometimes I'm better at it, but sometimes I'm like, why would we not give it to them? It helps them. Let's help people, right? Yeah. And I can still tell a good story about it at the end of the day, right? Yeah.
So can you talk a little bit, so someone maybe that is hesitant to try yoga, um, is there evidence that shows that yoga is different from a typical exercise program in terms of integrating your practice?
Yeah, there is. So back, it's probably a while ago already, maybe approaching 20 years, there were some basic studies of yoga versus exercise. And so those studies did show more improvement for yoga versus like exercise in a single plane, weight training kind of exercise. And so that is what we tend to use for control groups when we do one is we match for METs or like metabolic expenditure of yoga doing exercise in a single plane with movement. So those studies have been established. We know, we think, right? Like yoga is better. All of that work was really done in healthy adults. And so our group is the group that kind of started saying, well, what about people with stroke and brain injury? Um, and we haven't really tested it again, like just yoga against just regular exercise. I mean, it's always this like kind of control group that we're formatting really specifically to not do breath with movement and things like that.
Well, I think also society is so different probably when those studies,
Oh, yeah.
we felt like those studies needed to be done maybe 25 years ago, 30 years ago to kind of establish that. So speaking of studies, insurance companies and yoga, how do insurance companies view yoga as part of occupational therapy in terms of billing reimbursement? What are your thoughts? Or is it simply a modality we're using?
I think it's somewhere in the middle and the whole, OT, it depends kind of answer. Um, so part of it is population, right? Like mental health is way more likely to be cool with it. So we actually did a study on this and we surveyed and then spoke with therapists all across the country who were integrating yoga into practice. And their takeaway was, insurance is not going to pay for yoga, right? Insurance will pay for an occupational therapist using therapeutic activity that is yoga to get to somewhere else, right? And so they were really thoughtful about how they wrote things. They maybe don't even include the word yoga. I think it really depends who they're writing to, who the population is. We've worked with folks in the burn ICU, right? And yoga there really makes a lot of sense, right? It calms the nervous system. Helps them stretch out. You can cool yourself. You can heat yourself with your breath. And so I would say those therapists have become able to finesse their notes that insurance companies have pay. One of my goals in life is to provide the evidence that it is not this crazy thing, but that people are using yoga. A study that my colleague, Dr. Jacqueline Stevens, and I just got funded is to try and figure out some of the whys because we can say all day long yoga works, right? But if we don't know what's changing, it's harder to sell to the insurance company. I don't really care. I'm just happy. Like it works. People are happy, right? But we are going to work with folks who have brain injury and do brain imaging with them. We'll do MRI with them or fMRI with them, and then something called FNIRS, which is really exciting and Dr. Stevens' work, but they can wear a cap with electrodes on it, and we can actually have them do yoga postures wearing the cap, which is exciting because we can see the change in the brain. And so she's really excited. She sends me pictures of people's brains and I can see they look different. But that's why we have to collaborate, right? I bring the yoga, she brings the imaging, and we can see the brain is changing, which is exciting again in only 8 weeks. There is some cool evidence on mindfulness. So not yoga, but yoga includes mindfulness and meditation in healthy adults. we know we can actually increase gray matter and increase connectivity in the brain with meditation. So that's kind of where we're trying to get to with the yoga research, right? Is like, what is changing? Is there a part of the brain? Is it the motor cortex, right? What's changing? What's connecting better after an injury? So we are actively working on that. And I think our group, our team, and now some other folks are really starting to try to add to the literature that, we had to start with baby steps, right? Could someone with stroke, is it even feasible? Could they even safely do yoga, right? And now we're way past that, right? We can absolutely say, I feel absolutely like, yes, they can do it. Yes, it's beneficial. And now we're at this point of trying to figure out the why. The more mechanistic things that some folks care about, right? What's changing in the body. So that is relatively new in yoga in people with disabilities.
Gotcha. Yeah, and I think I mean, there certainly are a number of OTs that have kind of maybe they're collaborating with the yoga studio and are providing some of these interventions on a cash basis. But obviously, long term, if we can have that as part of our typical, evaluation and treatment that we're doing, that's obviously. So thanks for doing that on behalf of the profession and getting there.
I mean, like I said, I'm so happy to do what I do. I mean, I love it really. So,
So could you talk a little bit about maybe precautions? You talked a little bit about, seated and that sort of stuff, but precautions to make sure, one of our first priorities is safety, to make sure that everybody's going to be okay after the session is over.
yes. So biggie, is physical safety, right? And so we're always working to prevent a fall. And so far, so good. Knock on wood. We have been very safe. But even something like a forward fold in a chair can make someone feel really dizzy or really nauseous. And so we talk to people about that, like the whole listen to your body thing. People have become really disconnected from their body, especially after some of these injuries. And so we're really working with them to listen to their body. Tell us, right? Tell us if you feel dizzy and let's sit back down. So that physical safety is really important. Getting to the floor, I think, is really important for the yoga, but we have to do it safely, right? That's where we're more likely to have falls occur. And getting off of the floor, of course. And then I think there's this whole part that we don't necessarily think about in any yoga or meditation. We can kind of bring some stuff up that we haven't thought about for a while or that we've kind of packed away. And so sometimes people become really emotional or tearful during yoga, and so we want to make sure we're kind of checking in with folks. It doesn't happen every session by any means, but it's definitely happened. And I would say uh, we kind of think it's a lot about hip openers, and so we tend to think that we hold a lot of stress and anxiety in our hips, right? This is this idea. And so when we open the hips or move people into more of an extension posture, there is that risk of having some emotion. And so just kind of being prepared for that, being not like, whoa, what's happening? Or why are you crying for no reason, right? Like being ready. But it's part of OT, right? Like using your mental health background, treating the whole person, right? And then there's a couple things like we should not, in acute, particularly acute brain injury, acute stroke, we should not be doing any inversion. And so I think everyone knows like we're not standing on heads, but you could think, oh, a down dog, which is when you kind of make a V with your body facing the floor. And so then your head is below your body. And so we wouldn't want to do that with an acute injury, an acute brain injury. And so we would kind of say like, oh, there's no exact like science here, but we would kind of say you should probably wait at least a year to be doing those inversions for someone with a brain injury or stroke. Just to not cause damage. We want to be helping and not causing damage. So, and we don't know enough. So it's not necessarily that we know that. It's really that we don't know enough.
Gotcha. So what would an occupational therapy personnel bring to yoga that maybe just a typical yoga teacher from a studio? So why should an OT maybe be doing some of this instead of sending them to the yoga teacher down the street?
Yeah. I love working with OTs who are yoga teachers. That's the person who I love to hire, and it's because they understand anatomy and physiology better, right? Like their training is just more advanced. They understand precautions, so. An easy example is like a hip precaution, right? A yoga teacher probably has never heard of that idea before, a hip precaution after a total hip, right? And an OT will know that and understand just how important it is to follow those protocols. And then OTs are, I would suspect, um, maybe I don't know the right word, better at following like a standardized protocol. So if I come out and I'm like, these are the things you should do, or don't do an inversion because of this, I think an OT is more likely to kind of say, oh, we're going to take this step by step and get this person where I need them to go. Where a yoga teacher just doesn't quite understand evidence-based practice. Of course, not everybody, right? But we talk so much in education about evidence-based practice and protocols and standardization and safety. I think an OT can really bring a lot to that yoga component. And then I think an OT has those abilities to manage like the mental health issues that could come up, that might be a bit of a, just like a neglected surprise if it happens in a yoga studio. I will say here, my lovely life in Colorado, we do have we have adapted yoga at the community level, which I don't really know other communities who are doing this yet. And before the pandemic, it was in person, specific for Parkinson's and MS and things. And it wasn't us doing it; it was happening without us. And people just realized, like, we have a population. Let's do yoga. They want yoga, but they can't go to a yoga class. And so, of course, COVID and all that, and that's kind of moved online. But I think we're a community who does that well. But most folks would struggle to be able to go somewhere and take a class. I would say they would have to go, if there's a senior center who offers senior yoga, is probably the best bet.
In terms of providing individual intervention versus a group intervention, can you talk a little bit about the difference between those two when you're using yoga as part of your practice?
Yeah, we've only done individual a handful of times. We've done it with brain injury and in the inpatient rehab setting. Um, so I think it's really nice because you can really connect with that client and meet their individual needs. So, right, if they're like, oh, my hip hurts, you can really address hip pain through yoga. Um, we mostly do group yoga because what we hear is they like that group intervention. They talk before and after. Um, they seem more likely to have better attendance when it's the group because it may or may not be about the yoga, but it might be more about showing up and seeing people. In the group yoga is a little harder because we have to, for a study, right, we have to standardize it and say everyone got the same yoga. But as OTs and yogis, we want to meet people where they are. And so what we kind of say is it's the standardized intervention. Everyone was offered the same thing, but we tailor it to their individual needs. So if they need an extra yoga block or something, we consider that, yes, they still did this pose, but with some additional modifications. So I like both, to be honest, the one-on-one and the group. I think there's different benefits. I think we can target things a little differently in that one-on-one, but I think we have better outcomes with the group, or at least that's what we've seen.
Okay. Can you talk about maybe some clients that have really benefited from yoga? Do you have any favorite? You've already talked a couple about some of the stories, but particular clients you've worked with that have really.
Yeah, so two that I just can't ever let go of. It happens to be they both had aphasia actually, but one gentleman had his stroke 22 years ago, right? So a long time, and in his 40s. And if we have a stroke in our 40s, it changes our life dramatically. He had to stop working. His kids were still little. It was very traumatic for him, in addition to the stroke, right? And all he could say was yep. So he could understand, he could follow direction, but that was all he could say was yep. And so one day, so often it's the wife, of course, makes them go to the yoga. And so we always include the caregiver or the wife or whoever. if they want to. And they came to yoga, and he followed directions. He was doing everything. And then one day, this really happened, in about week 3 or 4, he said, Arlene, shut off the lights. And everyone was like, wow, you don't talk,
Uh-huh.
right? And so, like, he knew my name, he knew what was happening. This beautiful sentence he said, right? And so, like, that's not neuroplasticity, right? This was like week 3 of a yoga intervention 22 years after his stroke, right? So he really sticks with me, and I think we'll never understand that, why that could happen. I personally think it's more being in the present moment. He was really stuck in the past of, why did this happen? Or, I can't work, or I couldn't raise my kids the way I wanted to, things like that. And so I think yoga helped him just be more okay with where he was in life. And yeah, then he said this great, beautiful sentence. And then another guy, also with aphasia, but it was more his wife. So she became the caregiver, right? And so they both did yoga together. And we make sure, if this is happening, we're really taking care of the person so that the caregiver can do yoga and get the benefits of yoga and not feel like they're having to worry about their person doing yoga. And so they were at home, and she was doing a shower with him, right? Just like everyday life now. Life is hard after a stroke. And he took the shower and squirted her with water and laughed, and he thought it was like the funniest thing ever. And she said, she came back and told us that she's like, it was the first time I felt like we were a couple and not a caregiver. And it was, they had this shared occupation of coming to yoga together. And I think it was really powerful for them as a couple, because we lose a lot of those occupations after a stroke or after taking on this really big caregiving role. But there are two folks, I mean, I have so many folks in my head. After almost 20 years, right? But those two, I just always kind of just love, and love to hear those kind of stories. And then the one other person who's really in my head is a lovely woman. And I wrote a book on yoga and stroke, and she's the model for it. And so she is fabulous, right? Like, she came to yoga, she loved it, she could feel parts of her body again for the first time. And she'll just tell anybody who wants to hear about how great yoga is. But she was the model for our book and did all the postures, and showed people like how you adapt yoga for someone. And she has quite a lot of hemiparesis and her leg and her arm, and she was able to do everything, right? We just modify and meet her where she is. So yeah, just all, I mean, there's so many great people who've we've worked with. So we're really lucky, because that part of me, like the therapist part of me, feels like still satisfied, right? Because I get to see people, hear people.
Well, and it's the wonderful thing too is that you're doing an intervention that is an occupation that they can take with them, even after the intervention is done, and so that's a really cool thing.
Yeah,
So,
and we hear that they really go home, and they'll do, they kind of take yoga apart and do the parts that they like the best. And I think that's just fine, right? They're still doing the things that feel good and that they love. So, yeah.
wonderful. So you mentioned your book. So do you want to talk a little bit about your book, and then maybe advice for occupational therapy personnel that have been intrigued, as I have, to get more interested in yoga personally and then as part of their practice?
Yeah. So the book is, I'm quite proud of it, right? Because writing a book is not very fun. Um, it's a lot of work, and but I really am so happy with it. And what I think is what we did a good job of is, there's a whole chapter on stroke 101, so kind of anyone can kind of come into it and learn about basic stroke. But then there's a chapter on yoga 101. So I think it can be really foundational for people to understand some of the things about yoga and make it less hokey maybe, and kind of understand, like, there's some physiology behind what's going on, and it makes a lot of sense when we think of the parasympathetic nervous system. So I really like that. And then it goes into talking and showing off our model, and going through pose over pose after pose, and like how you would modify them. And so I think it's a really, like, a very practical book. It has handouts and things that you could give to clients to work on their poses and their breath work. And then My primary collaborator with that is Marika Van Pembroek, and she's a rec therapist at Clemson University as a professor there. And so we do a lot of our work together. So it has that like the twist of like RT and OT together, I think. So it's kind of nice. But yeah, I think for all
And
of
is that
us,
is that available on
oh, sorry.
Amazon, or where would you get
It
that?
is, yeah.
Okay.
I think it is just called Yoga Therapy for Stroke, actually. So it has a pretty blue cover that
Oh,
I like.
nice.
But I think all of us, like I've been talking about yoga for 25 years and doing yoga for 25 years, and it ebb and flows for me, right? Like there are times when I give it up, and then I definitely feel it, and I give it up because, like all of us, we get busy. Um, but I think there's a ton online that we can follow really easily, and even more with COVID. I think it's one of those things, if we all did 5 or 10 minutes a day, it is actually better than 1 hour a week, is my gut response to that. I think including some breath work is probably really powerful for us as we can calm down our nervous system, be more aware, be more in the moment. And I talk to my students a lot about that, like being in the moment with your client, being in the moment in class, like being really truly present is part of yoga. And I think it can really help most of us be better therapists at the end of the day. So, regardless of if you're teaching it to your clients or not, I think it's something for us to be a better therapist, which is kind of cool. Yeah,
That's
yeah.
what they say. Clients oftentimes don't remember what we did with them, but they remember how we made them feel, or how they
Yeah.
felt when we were with them. So,
Yeah, it's so true. And if you're truly with them and not worrying about, getting your notes done or whatever, I just think we're better therapists. So I think it's just powerful in many different ways for us.
well, wonderful. Well, Arlene Schmidt from Colorado State University and Yoga Therapy for Everyone. Is that the book?
For everyone. Oh, the book is Yoga Therapy for Stroke,
Yoga
but
Therapy for, but your philosophy is yoga for
my
everyone.
philosophy, yoga for everyone,
That's right.
regardless of disability, population, where you live, yoga for everyone.
Wonderful. Great. Well, thanks so much. Really enjoyed the conversation and hope you have a great day.
Thank you so much.